Good morning. I want to thank everyone for joining us here today. We wanted to provide a brief update surrounding COVID-19, but really highlight and make sure the public is aware that there are treatments available. We know that there is increased spread of COVID-19. We know cases are going up. We're seeing a slight increase in hospitalizations, and we really encourage people to be cautious and know that there is increased transmission that is happening right now. But for those who have a positive test, we want you to know that your county, in partnership with the city and with the state and with our health partners, we have treatments available for you that we know are incredibly effective at reducing the severity of the illness. We also want the public to know you do not need a PCR test in order to access treatment. So many folks now are using home tests. And a part of that is why maybe our case numbers that we put out each day aren't climbing as much as we know it's spreading. Fewer people are getting PCR tests, but even a rapid test you get at home, you are eligible to call us to make an appointment and seek out treatment. We have the monoclonal antibodies that treat and prevent COVID infections. We have oral and intravenous antivirals. We also have the antiviral pill, Paxlovid, which needs to be started within 5 days of symptoms. All of those are available. They are open. Our sites are open 7 days a week. All you have to do is call 619-685-2500, 619-685-2500. Make an appointment and get in and seek treatment if you have a positive test. You know, San Diegans have done really well. It's been an incredibly difficult few years as we've worked our way through COVID. As we stand here today, 94% of San Diegans have been vaccinated. We have one of the highest vaccination rates there are. We also have an incredibly low COVID death rate, and as a county, we have done incredibly well in our fight. But as we enter Memorial Day weekend, a lot of people socializing, a lot of people out, we just want to let you know that there is increased spread and transmission. We see it not just in the PCR tests, we see it in the wastewater monitoring data, and we see it in an uptick in hospitalizations. Now, we are in a much different place today than we were in previous iterations, and so there is no discussion of closing things or lockdowns or masking or any of that. What there is, and is an awareness that we want the public to have. There is an increased spread in transmission, and we encourage you to make individual decisions based on your level of comfort and your concern and caution, but also to highlight and make sure folks know that there are treatments out there that are aware and we know that can work. San Diego County has been a national leader in delivering treatment to the community. U.S. Office of the Assistant Secretary of Preparedness and Response used our treatment efforts as an example for what other counties across America ought to do. County medical providers stayed ahead of the curve with COVID-19 treatments, followed the medical information closely as the virus evolved, and adjusted the medications offered to ensure that the treatments administered were the most effective ones out there for the variants that are circulating in our community. Our first monoclonal treatment was delivered February 9th, 2021. To date, we are at nearly 10,000 monoclonal treatments that have been administered. As of May 15th, we are at 9,631, so we very well could be over 10,000, if not today, any day now. But we are fortunate to have a host of treatments available, not just the monoclonal antibodies, but the other treatments I mentioned earlier, the antiviral pills, Paxlovid, oral and intravenous antivirals. And again, some need to be started within 5 days of symptoms, some within 7. But you can get those at our MARC sites. We're here at one right now. We also have MARC sites in Vista, Hillcrest, and Chula Vista. These sites are open to all San Diegans. Regardless of insurance status does not matter. Your insurance status does not matter. Your immigration status does not matter. If you have a positive test, whether it's a rapid test you took at home or a PCR test, call us, make an appointment. We are here to provide treatment and help to you. We know the treatments work. We know they can lower the risk of severe illness and hospitalization by up to 90%, which is something that is going to be very important. And so they protect those who are vulnerable and those who have been impacted. And so again, we're here today to let people know, hey, cases are rising, exercise some caution, but also know if you get a positive test, we have treatment that is here. It is available 7 days a week. Please consider calling, getting treatment, and of course, talk to your own healthcare provider if you're more comfortable doing that as well. That is a perfectly wonderful option as well.